Welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Reed Davis speaking on functional testing for women's health. Reed Davis is a board-certified holistic health practitioner and certified nutritional therapist. He's also an expert in functional lab testing and holistic lifestyle medicine. He's the founder of Functional Diagnostic Nutrition and the FDN Certification Course with over 3,000 graduates in 50 countries. Reed served as the health director at a wellness center in Southern California for over 10 years, and with over 10,000 clients, is known as one of the most experienced clinicians in the world. Reed serves on the advisory board of the American Natural Wellness Coaches Board and the American Association of Natural Wellness Coaches. He lives in the U.S., and when not teaching the FDN certification course and helping his graduates build their private practices, he is usually found gardening or riding motorcycles. Hi, Reed. Welcome to the show. So excited to have you on today.
Thanks so much, Dr. Brayton. It's my pleasure to be here.
Yeah, so it's always wonderful to have somebody who has been in the field of holistic health for so long and have such so much experience under your belt. So I'd love for you to share with the audience a little bit, kind of what your background, your personal story is why you're so passionate about functional lab testing and holistic lifestyle medicine.
Yeah, thanks so much for the chance, because it's just my life. It is my passion. It's almost an obsession, to try to help people. And it started when I came out of the environmental law field. I was saving the planet, air, birds, water, trees, bees back in the 90s. And then at the end of the century, I started turning my attention to, well, what's this environment doing to people? If it's killing the birds, bees, and trees and bodies of water and you name it, well, what's it doing to us, including me, of course? So I switched gears a little bit, went to work in a clinic, and it was just been a fascinating experience ever since. I could tell you more, or did you have a question?
Tell me more.
All right. Yeah, I thought I heard you cutting in there, but well, fantastic. When I went to work at that clinic in 1999, there wasn't functional medicine, complementary medicine, integrative medicine. It was just regular or alternative. And alternative was kind of frowned on back then, quackery and things like that. Of course, it wasn't. These are people who look at it from a different point of view. So, and that was me. I wasn't a physician, so I had to take the alternative view. I didn't want any parts of diagnosing and treating disease. I just wanted to understand health and what creates health. But everyone walking in the door, Doc, it's amazing. And you know what I mean? They'd all seen 5, 6, 8, 10 different practitioners, and they weren't well yet. Well, we were a wellness center leaning to the alternative stuff, chiropractic, acupuncture, and nutrition and massage and things like that. So I was actually studying at the time. I immediately started studying nutrition, and personal training and things. But again, everyone walking in the door had already seen a lot of practitioners and wasn't better yet. And I just made it my business right then and there. I thought they all must be getting ripped off. And I saw an opportunity that if I could help them, I could have a great business. But also, I just thought, I'm going to be the last one you need to see. Because this was in a clinic, brick and mortar, face to face with Mrs. Smith or Mr. Jones. And you see the tears. And I've been to 8 people and I spent all this money and I've still got my whatever it was, tiredness, fatigue. And by the way, on the topic today, we did see an awful lot of women who were infertile or weren't able to conceive and things like that. So it was just an amazing opportunity. And just thank goodness I was able to run labs through the doctors who worked there. As a non-physician, I couldn't, but I found a way. And I made it my business. I started running thousands of labs on thousands of people for 10 years. That's what I did. And I just ground it out. And I did things that people say can't be done because I didn't know you can't do them. Just the volume of work. You've heard that expression before. I didn't know you couldn't. So I became the guy who was running thousands of labs on thousands of people. It's just the only thing I knew to do. And over those years, Doc, I recognized patterns. Now, I had some great mentorship. Some of those alternative guys back then and women, they were amazingly brilliant working outside the box, as we would say back then. These were the pioneers of integrative and complementary medicine. Now it's functional medicine. A lot of people claim to practice it, but I was just in the trenches running thousands of labs on thousands of people, making observations, and I systematized a step-by-step investigative process, like what to look for. And this is true no matter what their problems were. No matter what their diagnosis was, I didn't have much interest in that. I go, well, what's really wrong? And I thought, I found out over all these years that it was, there's actually an acronym for HIDDEN. And when I look for hormonal, immune, digestion, detoxification, energy production, and nervous system balance, HIDDEN, when I looked at those things and identified healing opportunities and had the person go home and work on it, using just self-directed self-care, then they had great results. Just didn't, so I learned my own system, developed my own system of sort of ignoring not the symptoms totally, but whatever the diagnosis was. And now I've got a very well-rounded group of people I've taught this system to. For 13 years I've been teaching. And so it's quite a group and quite a system.
Mm. So I think that's really fascinating to me is, when there were no boundaries, you were just like, let's gather all this data. You were curious, you were investigator. And I think also you hadn't been brainwashed by the allopathic traditional schooling, right? Which can be the challenges with a lot of traditional physicians. So you were just curious and you were like, let's get down to the root cause. Let's see what's going on here. And when you get all that type of data, you get like a lot of information and you start to see patterns, like you said.
Yeah, and it's really remarkable that the patterns just were so consistent. So as I was investigating underlying causes and conditions, some people call it the root cause, just what's really going on, where are the imbalances, where are the healing opportunities. They're just very consistently, mostly within that hormone, immune, digestion, detoxification, and so on. And then that part about not being preconditioned or brainwashed, if you want, about the allopathic model, the Western medicine model, that's a two-edged sword, because it also means you can't just get out a prescription pad. So, you have to figure out, what does a person have to actually do? You're not just there to mitigate symptoms, although that's important, but actually just correct what's really the imbalances and remove all the interferences with health. And so that's the process. And simply it developed out of me, talking to people in the office and telling them that, look, it's not coming to the office that's going to make you well. Sure, you come in and you get your treatments, but it's what you do between visits that matters most. And that's where I developed, and again, this is a pattern that emerged, the DRESS, dress for health. And it's go home and eat the right diet for you, individualized, and get the right amount of rest, like DR, diet, rest, then E, exercise, obviously. And the two S's in dress are stress reduction and supplementation. And I don't have my own brand of supplements. I don't sell them, but I know a lot about them and recommend them all the time. But the stress reduction became one of the biggest areas where we could actually use the labs and investigate and create self-awareness in people, so they would go home and look around for all the stressors. Because if you eat right and you rest and you exercise, it's a good start. But if you don't find out everything that's interfering with health, it doesn't take you as far.
Mm-hmm. That's right. And emotional stress is such a huge thing in our culture and society right now, and especially like during the pandemic. It's really hard to avoid, right? So the reality is that stress is there. It's what you do with your lifestyle to help manage that level is so important.
Yeah, you're so right. And mental emotional is a big form of stress, and it's it's ubiquitous. It's your bills and your relationships and your job and your responsibilities and all the things that might create anxiety. So you have to have a system for that too. How do you reduce that? And there's lots of people who specialize in those methods. But the ones that I was more familiar with, obviously, with environmental stressors, having come from environmental law and saving the planet. They're ubiquitous as well, and they're also hidden. They're very well hidden, and you don't even know you're under these kinds of stress. So you have to be aware and educated and look around. And then another one, of course, is the biochemical and chemical stressors that, I mean, your own body makes chemicals that aren't good, these toxins and things, that waste products and exudates from other kinds of stressors like parasites, bacteria, funguses, and obviously viruses. Everyone knows about those these days. And they are stressful too, very stressful. And then, of course, physical trauma, weakness, poor posture and things is very stressful. If I said to the audience right now, everyone sit up straight, sit up straight. And when you do that in front of a live audience, you see a lot of people moving their bodies, like which means they weren't sitting up straight. They weren't maintaining good posture. It means they're weak, and there's imbalances in that area too. So it's all stressors, every kind of stress there is.
Yes, Reed, you're speaking the chiropractic message. So thank you for clarifying. Yeah, in the chiropractic world, we talk about how alignment in this, specifically the spine, is impacted by physical, chemical, and emotional stress, and all those stresses will actually negatively impact alignment, which then negatively impacts the nervous system function. So it is good to be aware of, the micro traumas. It's certainly a car accident is a major physical trauma, but there's micro traumas, which is bad, ergonomics, especially if you're working from home, having a bad setup with your computer and chair that's creating a bad posture. Or it could be, how you sleep, and it could be how you pick up your child. So all these types of things. And then the chemical stressors from our environment, as well as, poor nutrition, right? Junk food and other chemicals in our environment, alcohol, caffeine, pharmaceuticals, and then the emotional stress. So it's so good for people to have an awareness of how all of these stressors do impact our overall health and our body's ability to heal. I love the word you use, healing opportunities, because the body intuitively is always wanting to heal, right? So if it can't, there's an opportunity to find out where the blockage is and rectify that.
You're so right. Again, I think we're sort of preaching to each other here. And it's so great to know that you're doing and talking the same language. The chiropractic actually formed the basis of the sort of science, or FDN. What I practice and created is called functional diagnostic nutrition, or FDN for short. And it's the ology in our methodology. The ology came from chiropractic. It came from studying with a chiropractor. I was doing in the office, walking chiropractic patients back to their treatment rooms and talking to them. And then I learned myofascial release. So I would actually put them on the table and give them a little trigger point therapy, and maybe put a heat pack on them, waiting for the doctor to come by. And so it gave me an amazing understanding of the innate intelligence in the body, that every cell knows its job. You don't have to teach cells what to do. They know what to do. They just have to be left alone to do it, or not interfered with. And actually, more than that, nurtured. So as we nurture the innate, people get better. And that includes maintenance of the spine and nervous system, and again, hormone, immune, digestion, detoxification, and so on. It's remarkable how intelligent the body is.
It really is. It's so intelligent. So you briefly mentioned FDN. Can you go into a little more detail about what it is and how it works?
Yeah, I was developing, I became a nutritionist, nutritional therapist, got a certification in that, a personal trainer, myofascial release and massage, and all of these modalities and things. And at the same time, none of that alone was working. Chiropractic is very helpful. We had acupuncture, which works on, blood flow and energy and things like that. So I just really wanted something that would go even deeper. Like, let's say someone does have a diagnosed medical condition and they're taking medicine or something like that. Well, what's the philosophy I could apply to heal every cell, every tissue, every organ, and every system in the body simultaneously? So it's a real pure form of holistic health. You could say holistic medicine if you want, but it's what are those healing opportunities? They can be identified with the lab work, and then what are the general principles of health building that could be applied? Again, it's that thing to give them to do in between visits. And so,
Right.
yeah, it just became an entire holistic lifestyle. And I'm good at recognizing patterns. I like organizing things. And I like going out and talking about it. So I was doing lectures all over the area and just having fun. So I had to call it something. Eventually, I had to name it. Well, what is this thing you do? And it just came to me: functional diagnostic nutrition. It's functional in that it's about how things are functioning. It's diagnostic in nature. It's not medical diagnosis. And that's where people get a bit confused. It's just diagnostic in nature because we're looking at data. And then, of course, nutrition, because food matters, but also it's really more nurturing. It's nurturing of, so it's not just nutrition. It's nutrition for your soul, for your muscles, for your tissues, and so on and so on. So it just became I don't know, a cool thing to call it. Now we're stuck with it.
That's funny. Well, I really do is just make information, and then we're able to like educate and empower the patient to make lifestyle changes, which is necessary to get long life lasting results. Because, like you said, the passive care of what people receive in office is just a very small part of the healing journey. The epigenetic component outside of the office of everything they eat and drink and breathe and move and sleep, all of those things are what they're doing on their own. uh, that's the most powerful opportunity for change and healing.
Yeah, again, the just like you said, the ology in our methodology uh, is based in chiropractic. And one thing I learned is that objective findings are very important. And so when someone came in and we saw this is what I learned is I'm just learning early on that we would do these exams. They have back pain, neck pain, and just other problems. And so you'd have them stand up in front of a mirror and we do range of motion. We do some strength testing. We do some trigger point examination. The doctor would do some orthopedic exams. And then, of course, we could take x-rays in many, 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 or almost all cases. So now when you sit down with the person, you've had a really good examination. Then you go over the objective findings. So you could see crooked spines on x-rays. You could count the number of trigger points. You could measure the range of motion and strength and things like that. And so when you see it on paper like that, it's very meaningful to the patient. Look, this is what's going on, and here's our recommendations to correct it. So we're not just getting you out of pain. If it was back pain, a heat pack might work for a day. Even one adjustment might help for a week. But if you really want to correct this, here's what you have to do. And it takes objective findings. That's why I fell in love with the lab work, objective findings.
Yeah. And what's like you said, pain is subjective and it's also the last symptom. So when you can gather more objective findings, like you mentioned, and then just the functional testing that we're going to go into, you can also repeat those as the person's moving along their program and their care plan. You can repeat their range of motion and show that it's increased. You can, repeat their lab test and show that there's been a positive change in the values. And it's like there's progress, and it's way beyond how somebody's feeling, but it's really showing that there's internal changes that are occurring that are moving in the right direction towards health.
Yeah, and so that's when we started running a lot of lab work, recognizing that we needed more objective data. I needed more than just, an X-ray or something, and so the labs became very, very helpful. And I learned how to use hormone testing. You can look at the immune system. You can look at digestion. Are you actually breaking and absorbing food? And detoxification, of course, is the liver congested? And so on and so on. So there's these objective findings, once again, explain to the patient why they feel so crappy and give them a frame of reference that they can uh, take, here's follow these recommendations and we'll test you again. But you'll even if we don't spend the money on retesting, you'll know because your body will be functioning so much better. You'll have more energy and sleep better and lose a few pounds and foggy thinking clears up and on and on and on. Also, fertility can return and things like that. Like we've had people where fertility returned and we didn't even know that was their problem. I mean, like miraculous stories.
Yeah, so I'd love to delve a little bit more into that. Like, if there's a woman presenting who is having maybe some fertility challenges, what type of lab test would you recommend to check for her hormones or other, I mean, not just hormones, but other areas that can impact fertility?
Well, as I mentioned, whether it be infertility or some other issue, if you get enough of the constellation of possible healing opportunities. So I just want to know, well, what healing opportunities are there within the hormone, immune, digestion, detoxification? You can start there with just those four. So we would look at the hormones. How out of balance are they? The immune system, that can also be out of balance or over or under active. Digestion can be hardly working at all, even though you're spending all this money on great food. You're not really assimilating the vitamins and minerals and phytonutrients and things. And then detoxification, you can have a congested liver and not really know it, except you just feel like crap all the time. You're foggy thinking and all these things. You could have bad skin because of it. And then there's lots of other ways the symptoms could appear, the signs. But the problem is never the symptoms. It's what's upstream. It's all the dysfunction. So, I don't treat infertility. I just treat an unhealthy body. I think it was, Hippocrates said, we are concerned more with the person with the disease than with the disease. And so it requires holistic lifestyle. I'll just give you an example. When I was, years ago, I had a client and we've been working with her for several months. She had quite a few healing opportunities, including some parasites and yeast, and she had food sensitivities and all these things, and lots of complaints that go along with that. And so, we have the objective findings, how she felt, which was lousy. Got her on a better lifestyle, holistic program, and I think it was maybe 6 months later, she and I've been working with her at least on a monthly basis, seeing her every month. And I got a phone call, and what's she calling me for? Okay, I answer, and it's like, Reed, I'm with Jim, her husband. We just left the doctor's office, and we're pregnant. And I wondered, why is she telling me? I go, well, that's fantastic. I'm really happy for you. Congratulations, you guys. She had me on speakerphone. He goes, yeah, man, we're just so happy, and it's your fault. I said, what are you talking about? He goes, we gave up getting pregnant 9 years ago. It wasn't even on their
Holy,
list. It wasn't even on their list of complaints. These people were in their, I'd say, early 40s. And we gave up a long time ago. And we know, Reed, this because you got us on this holistic FDN program. And that she just was so improved, so much healthier. Her body just decided, okay, it's okay to conceive now. And she got,
it was sick.
is that remarkable or what? That's when I realized some of the power of just every cell.
Oh, the husband didn't do the plan, just the wife.
Just the wife, but you raised a really interesting point, because the more I have looked into infertility, because that was accidental and just made me think, oh wow, it works on that too. I've told people it works on everything. Well, there you go. And I have so many other good stories like that. But Now I do think, I mean, now that I've studied it more, yes, both partners need to be working on what I've heard referred to as the premester. So you have your trimesters when you're pregnant, but the premester is at least 3 months. I've heard you mention, perinatal periods. Well, that's before and after. They're both really important to maintain super nurturing of the body, and it would include the spouse. I'm convinced of that. The healthier the the donor is, so to speak, the better.
It's so true. We see that with the preconception work we do here with couples. And, culturally, I think people still put a lot of emphasis if there's a difficulty with getting pregnant, they really look at the female. But, fertility challenges 50% of the time are from the man. And in general, even if a couple hasn't actually started trying yet, but are wanting to optimize the health of the pregnancy and the health of the baby, we want to work on the epigenetics. And we can do that through functional medicine.
Yeah, and of course, just you want healthy sperm that aren't carrying genes that are already switched on, before they even reach the egg. So it really takes two to tango in a lot of ways.
Totally. And I think it is important. Yeah, once again, you can even get pregnant, right? Like, let's say you're doing IUI or IVF and you're actually able to conceive and carry a full term pregnancy. But the way the woman feels during that pregnancy and the health of that baby is impacted by what the parents did prior to the conception. And so ideally, it's more than just the outcome of giving birth to a baby, but it's a woman who's feeling amazing and thriving during her pregnancy, which certainly requires these lifestyle changes that we're talking about, and the type of birth that she has, and then also how the baby is thriving and successful after the birth.
Yeah, no, so true. A way people could think of it is you would never give a kid a loaded gun, right? You'd never give a kid a loaded gun, but you're giving them a loaded gun in terms of your genes when you're not right, when your genes are possibly switched on in negative ways, then you're passing that right along to your infant. You're handing them a loaded gun for genes that are, let's say, predetermined to be more potential for disease, more potential for obesity is the biggest one I see today, diabetes, and this way we have more, childhood diabetes today because you're passing on a loaded gun to that kid, and the bullets are basically the manifestation. That's what's going to occur. That's the way I see it.
Yeah, and I think once again, going back to how when you're doing these functional tests, there's such an opportunity to create empowered patients and parents, future parents as well, and really understanding, like we're talking about, that we have the power with epigenetics. So no matter if you're inheriting quote unquote poor genes from your parents and grandparents, you can switch genes on and off, like we're talking about, based on your lifestyle. And we want to have the negative genes switched off and the positive genes switched on.
Yeah, exactly. My father died of colon cancer, and guess what? Both his parents died of colon cancer. So both my grandparents on that side. So I know I've got those genes, and I've actually done a gene test and found out, yep, there they are. Now they're just potential. They're not the disease. They're the potential for it. And so they can switch on or switch off based on lifestyle, what you just called correctly epigenetics. That's the environment you create in your world that will determine whether those genes are switched on or remain silent. And so I've studied that, and well, what are the things that would switch those genes on? Well, things like eating processed meats is a huge one. Nitrates, they're devastating to someone with the colon cancer genes and other genes. And so I don't eat those. They're like poison, or it's like, why keep loading the gun? It's going to just go off in a bad way. So you can implement epigenetic lifestyle. Matter of fact, I consider the Dress for Health Specific program, DRESS, to be an epigenetic program. It is absolutely an epigenetic program. It's not as specific as some people might like. It's just general, avoidance or let's say building of health. And yet, if you can do a genetic test, find out what your specific inclinations are or potentials are, then you can dial that in even more specifically. Like the diet could be modified even further, like I've done with mine. The rest is always going to be important, the exercise. The stress reduction is probably the biggest one. Like to me, I would put nitrites and nitrates as an extreme stressor. They're an epigenetic factor that will, initiate a downward spiral that could kill me. And it's the potential's in every person. So I think it's pretty critical we all get on a good epigenetic program. That's why I've trained thousands
and like
of people.
You said,
Sorry.
Yeah, I mean, just like you said with the dress program, that's just almost to me like common sense of lifestyle, how you live your life on a regular basis, ongoing. You're going to minimize putting stress on any type of inherited gene that you want to keep silent, and that's awesome. So, do you do your? It sounds like you also do genetic testing as well.
It's not my first line, but it is a form of troubleshooting and refinement of a program. It's not my first go-to test. I want to find out how you are right now functionally. We start improving that, the function of your, the balance of your hormones, immune, digestion, detoxification, and so on. We get you where you're feeling pretty good, and a lot of your symptoms have disappeared. You're kind of back to the way you want to be. And now we can start dialing it in on a, we consider that part of the anti-aging and maintenance program. So, there's three types of care. And I learned this from chiropractic. There's relief care. You feel better. There's corrective care where we fix the misalignments and things. And in my case, it would be balance the hormones and get the immune system working and so on and so on. And then there's the maintenance care. Well, once you get, out of symptoms, then you really get yourself corrected. Now it's time. You're going to feel great. No matter what your genes are, you can get feeling really good. Now we start working on the anti-aging, longevity, true health and happiness. And that's where we might do a gene test.
Got it. So let's go a little bit maybe more into detail with the primary foundational type of test that you would run on a new patient.
Mm-hmm. Well, I always look at the hormones, and there's different ways to skin that cat. And, when I started, it was all saliva testing because that was what was most convenient for our clients, my clients. Just send them home with a test kit, or I can have a drop ship to anywhere, any place, anywhere in the country. I just, even, matter of fact, we have trainees now in 50 countries, but it's so convenient. Plus, it's the only way to get the true circadian rhythm. You need a morning, noon, afternoon, nighttime, and things. So saliva has always been inexpensive, convenient, and very accurate because it's the bioavailable levels. And I continue to use that to this day. But I'm also trained to use dried urine and blood, of course. So there's different ways to look at it. But the hormone test is an assessment of your, whether you're catabolic or anabolic. If you have a cortisol dominance, that's your stress hormone. That's dominant over your anabolic hormones, beginning with DHEA. Then, of course, you have this cortisol to DHEA imbalance. What is that? You're catabolic. Your body's breaking down. And there it is on paper. And guess what? People go, yeah, that's how I feel. So we get a high level of correlation. The same thing, other hormones. You look at estrogen to progesterone ratio, or mostly in men, we look at estrogen to testosterone ratio. These things. So looking at these ways you're out of balance in the hormones then it's fairly simple to correct, but you have to have the data. Even just your total cortisol can tell us something about you. Like I call it vital reserve or metabolic reserve. Some people are really depleted. I mean, they're in an exhausted state, and they really need to turn it around. And again, when you show people things like that on paper, they go, wow, no wonder I feel so lousy. What should I do about it? They're willing to follow instructions a little more, you know, dedicated. And so we call that all clinical correlation. So the saliva testing we do you get very high levels of correlation with the person. They become very motivated to change it. And of course, it's a baseline for further monitoring. And, it's just an amazing thing. And we go on to do like a gut health. We'll look at secretory IgA. That's your main. You've heard that most of your immune system is in the gut. That's true. And CIGA, secretory IgA, it's one of your body's defense mechanisms. Could be really overactive, or it could be not very active at all. And each one would tell us something in a way for you to correct it. There's imbalances there in the flora, the good and bad flora. So if you notice, I'm always going to turn to terms like balance, not diagnosing. There's no medical diagnosis. I find that if I ever slipped up and used one, it leaves all this other stuff that's really wrong on the table still. So the moment you focus in on one thing, I think it creates potential for errors and cycle of trial and error and things like that. So we look at the hormones, as I said, the immune system through that, the digestion through not only that balance between good and bad flora, but just a real abundance of the good flora that helps you break down your proteins and so on. And then, of course, you've got all the digestive juices. You can look at bile flow and the pancreatic enzymes and things like that. They can show up in a stool test. And then you've got detoxification. There's other markers that tell us that your liver, it's not diseased. Your doctor would say looks fine to him because it doesn't have cirrhosis or tumors or one of these. It's not got an infection like hepatitis, but it doesn't mean it's working good. Liver's kind of like a vacuum cleaner bag. You better keep that bag clean, or your vacuum doesn't work very well. And I've heard other similar analogies. So there's all of that. And then there's the energy production based on the oxidative rate that can be out of balance too, and the nervous system. If I learn nothing else from chiropractic, Dr. Brayton, it's that the autonomic, sympathetic versus parasympathetic needs to be in balance. So, what a health coach is a really highly professionally well trained health coach, like the kind that come out of my program. They understand balance in all these areas and resilience. And that is what health is. You have balance in all these things, and yet there's resilience. It's not really just one place you need to be. It's flexible. You could get a cold or flu, and you're going to be fine. You could even get COVID, and you're going to be okay if you have balance and resilience. So it's the perfect complement to any other form of healthcare. I mean, not saying people don't have bad diseases, but this is a perfect complement to it.
Yeah, and I think that it is important to understand for a lot of people. We've been conditioned, especially with a pandemic, that viruses are bad, and parasites are bad, and yeast is bad, and bacteria is bad. The truth is that if they're not, it's all about the balance. When you have an overgrowth of those microbes, that will create symptoms and dis-ease. But we have all of those things naturally and normally in our body, and we need all of them for our functioning, right? So it's like having a different switch of understanding that we don't get sick from germs, right? The germ theory was proven hundreds of years ago. So it's really an awareness of the terrain and therefore the microbiome, and what you're talking about is checking, is there imbalance, let's say, in your digestive tract with these types of organisms, and if there is, then that balance does need to be restored to have health.
Yeah, you're so right. I recall some of those arguments between Beauchamp and Pasteur, of course, and then later you look at Jonas Salk, who's from San Diego, where I am. He invented the polio vaccine, but never took it and never gave it to his kids. He said being healthier is easier and more better, so to speak. It's kind of humorous in a way, but Just Dr. Jeffrey Bland. I know you know who Bland is, of course. He's pretty much the father of functional medicine. And I was on a Zoom call. There's 50 people in the call. He wasn't talking just to me, but I was on that call just 3 weeks ago, and he said, "Look," he goes, "we're all going to get exposed to COVID. We're all going to be exposed. So this, you might as well just like get yourself really healthy so you're resistant to it, just like most kids are, and on like that. That's the trick."
It is the trick. And that's all for me very common sense. When you have any type of contagious virus, there is going to be exposure, whether you wear a mask or not, whether you wash your hands or not. But it's really also, I think, feeling very empowered that you don't have to be afraid about exposure if you're living a healthy lifestyle and therefore having a strong immune system. There's nothing to be, it would be like saying, I'm afraid of the flu, right? And like, it's like, well, why would I? If I'm a healthy adult who, practices what I preach, and recognizing that it's really the immune compromised segment of the population that needs to be protected, quote unquote, but not the masses.
Yeah, I agree with you 100%. And I do wash my hands frequently, and I avoid unnecessarily being exposed to things. They say if you lay down with dogs, you get up with fleas. So you don't just brazenly walk into the COVID ward at a hospital with no gear on. But at the same time, you can't live your life. You can live your life in a way that where you build your resistance. Just again, the idea of balance and resiliency and high level of resistance. If you don't have the what are called comorbidities, if you're not like over 65 with diabetes or heart disease or recently had cancer and some of these other things, then you should be resistant enough.
That's right. And I do think that, unfortunately, living in fear is a massive emotional stressor. It puts people in this chronic sympathetic state, and that alone lowers your immune system, right? So having that awareness, that you ideally don't want to be feeling panicked, anxious, because of COVID, for example, I think is really important.
Yeah, it's incredibly important, and just especially, I mean, when you go back to the idea of pregnancy and pre, perinatal, prenatal or postnatal, or pregnant, which means you have a baby now, I guess. It's really important to not pass anything on to the infant. Matter of fact, nothing negative. So you want to pass on really good genes, of course. Some of those you can't change, but behave yourself long before pregnancy. I gave the example of a lady who just was really, I call it a state of metabolic chaos. I've actually trademarked that term because it's just so descriptive and defines. That's for a health coach. That's your one diagnosis. It's not a medical diagnosis, but it's one assessment that's true. If you're sick, there is metabolic chaos. In the moment you label a disease and just treat that one thing, like practice medicine, uh, then you're leaving all the other healing opportunities off the table. Like, why not just treat it all at the same time? Just the entire person, every cell, tissue, organ, and system, the whole organism. And there is a program for that. It's called Holistic Lifestyle. And my dress for health success is one of the. It's also a trademarked. We're granted a trademark because it's such a thorough and successful process.
So, if somebody's listening on today who would like to connect with one of the health coaches that you have gone through your program with FDN, how can they find them in their area?
Yeah, thanks so much. It's fdn.today/Brayton. So FDN, like functional diagnostic nutrition, fdn.today/Brayton, Brayton, after you.
Oh, wonderful. And then they'll get a list of practitioners that they can find in their area
Actually,
and go through this program
yeah,
to heal themselves.
that can be accomplished. It's just about our program, but we have a really friendly chat program there, so you can chat. You can just text back and forth, or you could actually get on a live call with a free counselor. I have it monitored like 16 hours a day. It's from, so we can go coast to coast and just talk to someone. And they're not salespeople. They're counselors who are looking for what direction to recommend to you. Some people, they want to take our course in health coaching just for their own edification. And if they only worked on their own health and their family's health, Dr. Brayton, that would be worth the price of admission. But the fact that for those who are interested in helping others can actually create a career out of it, it's quite a remarkable opportunity. So thank you for helping us direct people there.
That's cool. And then what if somebody is looking to go through the program to heal their own body? And is there a way to work with somebody like a health coach virtually, remotely?
Oh yeah, it's all virtual now, and that was interesting when COVID happened and they shut the economy down and closed up all the shops. We most of us just said, well, we already work from home because we, above all things, Dr. Brayton, is we try to walk the talk. It's actually the only two requirements I have to take my course is you want to work on yourself and walk the talk, and that you at least might want to help others. That would be a big part of it. But that could mean your family, friends. But if you want to turn it into a profession, you can. But it's the same URL. It's fdn.today/Brayton. And that my counselors will just put you in the right direction. They're really friendly, nice group of women who just want to help others, and they love working for me because it's such a cool thing to do.
Oh man. Well, Reed, I am so grateful for you to take the time to come on the show today and just share. This is definitely your passion. It's about really bringing education and awareness so that people can, take control of their own health and really goes back to feeling empowered, like you know what to do to be healthy and to help your family be healthy.
Well, thank you, Dr. Laura. We really respect and appreciate what you do. You're on the ground doing the work, and that's all I have ever asked of anyone is, pay attention, learn, and do some work. And you, of course, have earned, your way to that position, and you're doing phenomenal. So I'm here to support you in any way I can.
Awesome, Reed. Thank you so much.
Okay, thank you. Bye-bye.
So I hope you were inspired by today's podcast about how you can learn more about your own healing opportunities by testing and not guessing. And if you're also looking to shift gears and go into a new career, there's an opportunity here for yourself to go through the FDN Certification Course and start helping others heal their bodies as well. For more information, check out fdn.today/Brayton, Brayton, to get a discount. And don't forget to check me out on Facebook and Instagram at Brayton Birth Method. As a podcast dedicated to empowering families on making the best decision for them, I know how important it is to have choices. The Homeschool Buyers Co-op is the world's largest buyers club for homeschooling families. They have amazing free resources available on their website. And did you know it's free to join the co-op? They have the world's largest database of free homeschool curriculum, an incredibly cool free homeschool ID card generator, an amazing guide to field trips that are ideal for homeschooling families, as well as free webinars to help families that are making the transition to homeschooling. Go check out their website at homeschoolbuyerscoop.org and register for a free account with the code ADJUSTED to receive 5,000 smart points, which is equal to $5 toward anything available on the co-op.